Hi, my name is Nina Pralour, and I am a member of the Roslindale Village Main Streets Board. Today we're talking with Roslindale Center Chiropractic. Thanks for talking with me today, Dr. Kniffin.
Yeah.
Can you tell me a little bit about what your business does?
I'm a chiropractor. We're located in the Roslindale Village area. What we focus on is correcting the spine to release pressure and irritation off the nerves, allow the body to function better. Because the brain is the control center of the whole body. So you have millions and trillions of signals that travel down through the spinal cord and exit out each and every one of those nerves. And those nerves go to every organ, every muscle, and every tissue in the body. When there's a disruption from a misalignment in the spine, it'll affect the function of those nerves, go into those tissues, and cause dysfunction eventually. So as a chiropractor, what my job is to do is to align the spine back up, decrease the pressure and irritation off those nerves, and allow the body to function better.
How long have you guys been here?
January of 2018.
Okay.
So that's when we officially opened and got things going. The community's still learning about us, kind of seeing what we do, and so we're a family-based practice, so we treat pregnant moms and infants. We've had quite a few of those from the community, because I'm also on the International Chiropractic Pediatric Association website, so a lot of families have found me through there and treated kids as young as, I think, probably 3 or 4 weeks old, and then we've done as old as 85. So we've done a little bit of everything in between. Some of my background is also in sports. I used to be a chiropractor for a rugby team down at Life College.
Okay.
So I used to work on a lot of athletes, and I did my master's in sports chiropractic.
Is there different ways that you think people can get to know more about you? Or are there any, outreach activities that are happening, or that you would want people to know a little bit about?
Well, if they had specific questions regarding chiropractic and if they think it could help, they could always stop in. I'd give them a tour of the office, or if they have a question about a health condition, they don't know whether chiropractic can help, I'll either say, yeah, they may be a chiropractic candidate, or no, they should go to some other healthcare professional, which I'd refer them to. And we've done that several times as well. So a lot of people don't know if chiropractic can help them. We've helped a few patients with irregular heartbeat conditions. An office assistant at another office I worked at had really bad severe asthma.
Yeah.
And we adjusted her, increased the nerve flow going to the lungs, and her asthma disappeared. Headaches and low back pain are very common.
Yeah.
Get very good results with those, as most people know. We also have some very low force techniques too, so a lot of people get scared about the twisting and cracking. We don't do a lot of that in the office. We do it if it's necessary, but most of the ways that we adjust don't involve that.
Yeah, I think it's pretty important. I think sometimes you hear chiropractic and you think the stuff that you see on TV where people are twisting and it's hurt, and that's not the case.
Yeah, no, I would say we do very minimal amounts of that. So.
Great.
Some common conditions that we see in the office is neck pain, headaches, and low back pain. As you can see right here, here's the spine, and you have all these movable segments in the spine. So when these misalign or get out of alignment, it can put pressure and irritation on the nerves exiting out. And so these nerves wrap around and go, you have nerves that go down your legs, and you have nerves that go down your arms. So a lot of times we see when people have a misalignment in the areas of the spine, they get numbness and tingling to the hands or down the legs, such as sciatica, or they get headaches. So you also have nerves that wrap up and wrap around the head. So when these bones in the neck misalign, they're going to affect those nerves wrapping around the head. Oftentimes, people have no pain initially when these bones misalign. And on average, patients come into the office 10 to 15 years after the problem has already started. And so as you can see here, here's a normal spine of the low back. If left uncorrected, the discs start to wear down, just like the tires in your car. If one tire is misaligned, it'll start to wear down faster than the other tire. And so the same thing happens with the discs in the spine. And once they start wearing down, the body starts growing bone, which is called osteoarthritis or arthritis, to help protect itself. And so as a chiropractor, what we want to do is try and find and detect these problems earlier, so that way there's less issues in the future.
Thank you for watching. If you'd like to see more videos, please click subscribe.